Good evening. Thank you for joining us for Mary Washington Healthcare's first monthly recruitment conversation on Facebook Live. The second Tuesday of every month, you can join us right here as we discuss many areas of opportunity within our health system. Tonight, we want to focus our conversation on nursing practice in our Mary Washington Hospital Emergency Department. We will try to address all of your questions and keep the conversation moving. If for some reason you are not able to address your question during the event, a member of our recruitment team will follow up with you. And to start our conversation this evening, we have two very special leaders with us. First, Eileen Doman currently serves as Senior Vice President and Chief Nursing Officer at Mary Washington Healthcare and has maintained that role since March of 2015. Eileen has more than 30 years of nurse executive leadership in an acute and post-acute care setting. Dr. Kelly McDonough is the Administrative Director of Nursing Practice Operations at our Mary Washington Hospital facility. Kelly continues to lead our Mary Washington Emergency Department operations. Welcome to you both.
Thank you, Darla. We want to welcome our audience to our very first live event. And we wanted to welcome and talk a little bit about our Fredericksburg area, then talk about our Mary Washington Healthcare, and of course, our emergency department.
So it might be helpful to let some of our viewers know a little bit about Fredericksburg, Virginia, where we are, and a little bit about Fredericksburg, our community. Fredericksburg is about halfway in between Washington, D.C. and Richmond. It's an area that's rich in colonial history, so if you're a history buff, it's a great place. And it's a really nice mix of a nice small town, hometown, downtown feel with suburban and rural, just a nice mix of all the great things of a great community. And within Fredericksburg is Mary Washington Healthcare, which is a private not-for-profit healthcare system. We have two hospitals. Mary Washington Hospital is in Fredericksburg City. That is a 451-bed hospital. We're a level 2 trauma center. We're magnet designated, something we're really proud of.
Very proud.
Then Stafford Hospital is our 100-bed facility located about 6 miles north of Fredericksburg in Stafford County. And so we are very proud of our two hospitals, but most especially proud of the nurses that work at Mary Washington Hospital and at Stafford Hospital. So, Kel, why don't you tell them a little bit about what it's like in our Mary Washington Hospital Emergency Department?
Sure. We have some of the greatest nurses around. Mary Washington ED is probably, I came in 2004, and that's where I started my career at Mary Washington, and they are the best nurses that I've ever worked with. And it is a 50-bed ED. We serve a volume of 64,000 a year. They're supported by a great group of physicians, the Fredericksburg Emergency Medical Alliance, and in so much so that they support the nurses and their board certification for their BCEN. So we also support our nurses for being part of the trauma center. We have special training for those nurses. So that is just a few things that some of our nurses do.
The other thing that I'm really proud of, and Kelly's done a tremendous amount of work, is our professional development model for nurses across Mary Washington Healthcare. So Kelly, why don't you talk a little bit about ACE and our ACE program?
Sure. Our Advancing Clinical Excellence, we started that program in 2013. It's a ladder program. It's based off of Benner. And it is a competency program it starts off with 4 levels. It's level 1, which is a novice. Level 2 is a competent nurse. Level 3 is a advanced proficient. And a level 4 is an expert nurse. And those, you come to as you progress through your career at Mary Washington, you progress through obtaining education through a bachelor's degree, and then also going in front of your peers for advancing your career within the nursing.
One of the things we're also really excited about and proud of is not only do we support nurses' professional development at the bedside, but we also support their education. And so we, like many other hospitals, have a goal of having at least 80% of our nurses being prepared at the bachelor's level by 2020. But we don't just have that expectation, we actually work to make that happen for our nurses. So several years ago, we started a partnership with the University of Mary Washington, a Virginia university right here in downtown Fredericksburg, and we've created a RN to BSN program. So if you're a nurse that comes to us without your bachelor's, we'll expect that you get your bachelor's degree within 5 years. But not only do we expect it, we'll help you get there, meaning that we will help you be part of the University of Mary Washington program. We support you with covering the cost of your tuition. And in addition, we also have scholarship dollars available. And that's really all supported by the Mary Washington Hospital Foundation, which very much supports nurses across the health system. Another thing, Kelly mentioned FEMA, our emergency department physicians, and another way that they demonstrate their huge support of nursing across the health system is each year during Nurses Week, we do a nursing gala, which is one night a year where all the nurses at Mary Washington get to come out and party a little bit and celebrate. And actually the major sponsor for that event is FEMA, is our emergency department physicians. And then many of our other physicians across the health system also support that event. And so we're just really grateful for the physician partnerships that we have, particularly in the emergency department. You know, Kel, it might also be helpful to talk a little bit about behavioral health, because we hear that's a huge problem across the country, and many emergency departments struggle with having to best meet the needs of their behavioral health folks in their community, and that's something that I know I'm a little biased, but I happen to think we do a great job. So,
yeah, some of our we have mental health that is in our emergency department. They also.
Snowden, so our psychiatric facility. So a Department of Mary Washington is Snowden at Fredericksburg. So it's a 54-bed acute care psychiatric facility, 40 adult beds and 14 adolescent beds. And so we've got a place where we can take care of our behavioral health patients from our community. But the really great thing is when those patients come into the emergency department, we've got a very highly skilled team that can take care of those folks in the emergency department. We partner well with law enforcement. We've got a specific area of the emergency department where we can take care of those patients and best meet their needs.
And in support of that cast, I think you had also asked earlier about what makes up our ED. And our ED is, it of course, has your nurses. We also have emergency medical technicians. We also have paramedics. And our paramedics in our emergency department also support the nurses. They have an expanded scope within our ED. We also have transporters. And we do outside innovative techniques within the ED to see our patients efficiently. So that is just, and also a communications coordinator as well.
We've actually been doing a lot of work in the Mary Washington Hospital Emergency Department. We've identified over the last year that we've really got some opportunities to continue to improve our patient flow, not just in the emergency department, but across the whole hospital. And so we've been very fortunate. We've got some performance improvement, actually all of our performance improvement resources from across the health system are dedicated to the emergency department right now. We also have strong executive presence, so it's not at all unusual on any given day to see our CEO walking through the ED, checking on what's being piloted today or what's being tested today. So we're very fortunate to have those resources dedicated in the ED, and we're really working to decrease our patient wait times, decrease our turnover times, and really not just in the emergency department, but across the whole hospital. When a patient comes to our emergency department, we want them to get our very best care, we want them to be safe, and we want them to just have a great experience with us, and we focus on that.
And I think a lot of the collaborative efforts, it's not just the emergency department, that's what the special thing is. It's the hospital, it is our inpatient nurses, that we work together to make sure that we are collaborating to get to the patient to the right area. So with that, we also have a question that looks like it's come from one of our viewers. Darla?
All right. One of our viewers asked, knowing that you just went through and achieved the magnet status. Do you have plans to pursue a Lantum Award from the ENA?
Well, I think that's a great question. I think I think that's something we're very open to. I would love to look into that and to go for that as well. So, I mean,
Well, and I guess it's along the same lines as the ICU's talking about the Beacon
the
Award.
Beacon
So I
Award.
think for all of our areas of specialty, we're very much want to support that when our nurses say we think we're special enough to get any special designation, we absolutely want to support that.
so thank you for that question.
Let's talk a little bit maybe about some of the skill mix of what we see in the ED. I know you've talked about the different kinds of folks. So we've got our nurses in the emergency department, our EMTs, our paramedics, our transporters, the COMBOX. One of the other things that I think that our emergency department does really well is partnership with local EMS.
Yeah.
EMS week was last month, and I got a text message from Kelly around lunchtime saying, oh, by golly, there's 35 rescue squads in the ED. I got really nervous thinking that something catastrophic had happened, and meanwhile it was, we were serving barbecue out the back, and all the EMS squads came to have lunch to celebrate EMS week.
And all the T-shirts that you see everyone wearing, so it is our EMS. We very much value their service. We do ensure that we want to have that welcome feel when our EMS comes to the ED, as they are very, very important to the community, but they're very important to Mary Washington ED. We try to get them back out to the community as fast as we can, so that's one of our goals.
The other thing that I know I'm very proud of is our emergency department nurses and their level of involvement in their professional organizations. We've got emergency department nurses that are active at the Virginia Nurses Association.
And as well as in the ENA. So we do support that very much and encourage that at their local chapters, as well as either that or the regional or national chapters.
And that's something that you see across all of Mary Washington, is we really very much advocate for nurses to be involved in their professional organizations, to be involved at the state level, to really get involved in their practice. Which brings up another thing that is particular to Mary Washington healthcare nurses, and that's our shared governance model. Really shared decision making, that we involve nurses in decisions about their practice and in quality. And one of the things I say to nurses every 2 weeks when I get to meet new nurses or an orientation is participating in shared governance isn't an option. You have to participate in shared governance at the unit level, because that's really decision making about your practice. The last person you want making decisions about clinical practice on a nursing unit is me. Because that's not my area of expertise. I've made a decision to specialize in administration, but for our nurses at the bedside, when they're making decisions about the care that they're providing, they need to be the ones making those decisions. So we expect all of our nurses to be involved in shared governance at the unit level. But at the hospital level, that's where people can choose to get more involved. And we use a council structure for our shared governance model. And so we have some councils that are hospital specific, just to Mary Washington or just to Stafford. And then we have some that cross both hospitals. And what we look for is representation of nurse representation from every unit across the hospital participating in these councils. So we've got our Quality and Practice Council, we've got our Resource Management Council,
Research Council,
Nursing Leadership Council, Nursing Executive Council, and that's really where nurses come together and really focus on what they need at the bedside for their practice and for their quality of care. And so that's something, and those council meetings happen once a month on the same day every month. And so it's pretty easy to set your calendar knowing that it's the third Thursday of the month. That's when all the councils will be meeting. So it's a pretty powerful day around here. There's lots of big decisions that get made.
It always makes us feel good when, you hear nurses buzzing around what's gone on, especially in the Research Council. They've had some really, really interesting, I'd say, research projects, and one of them was for sure what do we carry, what germs do we carry on our phones? So that's something that we're still working through. Looks like we have another question from our audience. Darla?
We sure do. So once you help someone get their bachelor degree, are they required to work for Mary Washington Healthcare for a certain amount of time?
If we've been part of paying for your education, then yes, there is a payback expectation once you've completed your bachelor's. But we would hope that by that time you'd want to stay here and get to use your new degree. But yes, there is a payback period that's required. One of the things that I think is also a lot of fun is 3 or 4 years ago, when we first started this focused effort on increasing our BSN rate, we had about a 30% BSN rate at Mary Washington Healthcare. We're now up over 65% of our nurses have their BSN. So we're really well on our way to that 80%. But Kelly, let's go back and talk more about the emergency department. So if you're a nurse that wants to come to Mary Washington and wants to work in the emergency department, maybe what's your favorite part of working in the ED?
I think right now, I would say it is really about the teamwork that I think you ask any one of the nurses there that work in the ED, they'll tell you that it's the teamwork, it's the work that they do alongside their colleagues, and also working with the physicians. I think that's the variety, of course, of what we get in an emergency department. But here it is really truly working alongside your colleague. Looks like we have another question. Darla?
Darla's busy.
I know.
Busy. Do you have a good ratio of new grads, less experienced nurses to older, more established nurses represented on your shared governance panels?
That's a good question.
Great question.
Yeah. Because we are, I would say that with our new grads, as our new grads come into the organization, we do encourage them. They even get a taste of it through our program, the new grad program that we do have. And we encourage them to be part of the unit based. And then what you do find on many of the councils is either folks that want to try it and they start off at the unit and then they go on to the hospital level. And we do have a pretty good mix.
I think there actually is a very good mix of nurses, our more experienced nurses with our new grads. Something really exciting for us this year is in 2017, we've doubled the number of new grads we're taking on board, but we could only do that by looking really closely at did we have enough of those more experienced nurses to really take on and mentor those new grads. And so we're pretty proud that we've been able to double the number of new grads, but that's only because we've got a strong mix. One of the really nice things about Fredericksburg and Mary Washington is we have many nurses that have spent their whole career here. And so when you look at places like our NICU, we just had 2 nurses recently retire from the NICU, and between the 2 of them, they had over 65 years of NICU experience, all of it here. So pretty incredible. Darla, you got another question.
I do. What paths do you recommend to new nurses to ultimately become employed in the emergency department?
I would say,
Apply.
Apply first, right? So I would say if it's well known in your interview that is where you want to be. I would recommend that if you have a desire to be an emergency nurse, that it is in the cardiac area. If you start in the cardiac, if we can get you a rotation there or into one of our cardiac areas, then we should be able to have a fast track straight to the ED, because that's usually the fastest way to go.
So we do our new grad program twice a year, so in March and then in July. So if you're a new grad and you want to join our organization, especially if you want to get into the emergency department, is apply for our new grad residency program. Once you get into the new grad resident program, that's a program that goes for a year. And then just like Kelly said, you can request that you would be placed on one of our critical care or step-down units, and that's the experience that you need before you get to the emergency department.
And that's what we ask in the interviews. When it is me as well as the other administrative director at Stafford. Her name is Deborah Marineri, and her and I do all the new grad interviews, and we do ask that question, say, where do you want to be when you grow up as to be a grown-up nurse someday down your career line? And if it is ED, we definitely try to make sure that you get in the cardiac area. We have another question.
We have a lot more questions.
Okay.
Great.
What makes the Mary Washington Emergency Department the best place to work compared to other EDs in the area?
Well, I can answer this really quick question. We are the region's trauma center, level 2 trauma center. And I'll tell you, and I'll still go down, we have the great physicians, and we have we have trauma surgeons that are just fantastic work next to and that you can learn in this environment. We have a wealth of knowledge with the nurses that are there. It also was also special again about Mary Washington is I'm going to put another plug in for the Advancing Clinical Excellence, that it is truly a pathway in your professional career that I don't think in this region that you'll get anywhere. So, and that is it is the education that we provide, it is the mentorship that you will get, and also, which I did fail to mention in the beginning, is we have a board, a panel of all that watches over all the Advancing Clinical Excellence. It is the board for our model. And it is made up of 23 RNs, and they are the ones that actually do the peer reviews of anyone who wants to advance within our organization within nursing. So it's pretty powerful. It looked like we had another question.
We do.
Okay.
As many are aware, burnout in the emergency department is big. What is your current nurse to patient ratio, and do you flex up?
So our current ratio we follow the ENA guidelines. It is a 1-to-4 nurse to patient ratio. And when you have a trauma, that is where that we also have to take consideration on who watches your back part of your team. So those are flexing up would consist of if you. I'm assuming that you're asking about if you're going to 6 or 7. We really stick to within our main part of the ED, which is our team 1, team 2, is the 1-to-4 ratio.
Excellent. It appears nursing is your passion, and your nursing staff shares that. Do you have nursing in your blood, such as family members or others that are in nursing?
You want to go for it?
I
She has
do.
a great story.
I do. My mother's a nurse. Retired nurse, was actually a VP of nursing at a hospital up in New York where I grew up. She was in that role for 25 years. And when I first went away to college, I thought I wanted to be a doctor. And came home after my first year, not so sure that that's what I wanted to do. I had had the opportunity to work at her hospital as a unit secretary every weekend. And I saw every doctor every weekend. And I thought, but decided I thought I wanted to be a nurse. And when I went home and told her one school break that I was changing my major, her response to me was, well, what makes you think we want you to be a nurse? And I was a little bit shocked, thinking she doesn't look happy. Why wouldn't she be happy? And she said, you don't decide to be a nurse because you don't want to be something else. You decide to be a nurse because you know what it takes to be a nurse, and you know what a nurse is, and you want to do that. So you figure that out, and then if you want to be a nurse, we'll wholeheartedly support you. So she's been my biggest fan. She's been my mentor. And so, yeah, so I would very definitely say that the passion for nursing was genetic for me.
For me, I would say I started my career in the Army, and before then I wanted to be a helicopter pilot. So I'm a far way away from a helicopter pilot, but I'll tell you.
I don't know, Cal, some days in the ED.
But I will tell you, I do have one influencer actually two in my life. My grandmother, Eleanor Sullivan, was a social worker, and she had graced many hospitals and also in the ED. And I'll also tell you that my aunt, who's now our CRNA, Kathleen Sullivan, has also been one of my biggest, I've always followed her. I adore her. So those are probably people in my life that have influenced my career path.
These questions are good, Darla. Do you have any more?
I know. They're coming in so fast. What if you're a new grad but want emergency nurse experience? I have urgent care, but only 1 year of experience.
So if you're, if you're a new grad, so if you're in school, let's start there. So if you're somebody who's in school and you believe that you'd like to end up in the emergency department, one of the things we would advocate for is to get a job in a hospital and get a job in the emergency room. Because I know when I was in high school and college, I actually was a secretary in the emergency department, and I loved just seeing what was going on and watching what the nurses did. But I certainly learned a lot about how the ED operated and then how the units operated. So if you're in school, then get a job in a hospital so you can get exposed. That also gets your foot in the door as far as some experience. Then if you're a new grad, apply to our new grad residency program. But right from the very beginning, make sure you're clear that I want to end up in the emergency department, because then you would want your first assignment as a new grad to be on one of our step down or cardiac units. So.
They're not.
Now, if you're
So-
someone who has maybe 1 year of experience, so you've gotten out of school, maybe didn't get that first job in a hospital, you've got a year of urgent care experience, but you still want to get to the emergency department, you can still apply to our new grad residency program. Another program that we've just started this year is for those nurses that have less than 9 months of acute care experience. We're also trying to do a med-surg residency. And as a way to offer some additional support beyond just our typical orientation. So I think if you're someone that is not a new grad, but maybe you've had some nursing experience, but not in acute care, I'd apply to our new grad residency program. And just right from the very beginning, let us know that you'd like to end up in the emergency department. If you've got less than some acute care experience, but it's that 9 to 12 months, then you apply for a job with us. But again, right from the very beginning, we've got great recruiters that work with us within HR. So if you let them know this is where I want to end up, they do a great job of letting our hiring managers and directors know, and we can get you steered in the right direction.
Okay, we have about 3 minutes left, so what would you like to do to say in summary, and then I'll close this up.
Okay.
So I think I will just, if you're interested, we'd love to have you. We'd love for you to apply to Mary Washington Healthcare. But I'll tell you, I've been here since 2004. It is one of our passions, one of my passions. It's not just the emergency department, but the whole, all of nursing. And I would also ask you that as you're going through and looking at us, look us up on MWHC. Look for yourself. Look at the hospital. Look at the services. But if you're looking for a career for application, go to MWHCcareers.com. We'd love to talk to you further.
Thank you very much for joining us tonight. It's really been great for our first time. I guess we were very nervous, and so I think it's worked out to be a great experience for us. We hope it's been the same for you. I also joined the organization in 2004, and I've worked in a number of different places as a nurse, and this is the best place that I've ever worked. And we've got some of the best nurses that you're going to find working here at Mary Washington Healthcare, and particularly in our emergency department. So give us a good try. As Kelly said, look us up on MWHCcareers.com and come work at Mary Washington Healthcare. You'll be glad that you did.
Thank you. Thank you for leading the conversation. Thank you for your questions. I failed to introduce myself at the beginning. I'm Darla Burton. I'm the Director of Recruitment. There are many questions we did not get to tonight, but I will have a member of our team follow up with you. We'd love to speak to you further and keep the conversations going. So thank you again for joining us. Please plan to attend our next Facebook Live event where we will discuss working at Mary Washington Healthcare with Kathy Wall, our Senior Executive Vice President of Human Resources and Learning and Organizational Development. That'll be held on August 8th at 8:30 p.m. Thank you again.